Hey guys, this is Dr. Jess, and this is our next installment of the new podcast, The Answers. This week, I'm going to talk about the actual root cause of all illness. And again, I made a nice little PowerPoint, and guess what? I'm not going to leave you hanging at the end. Okay, so let me get this all set up, and maybe 15 minutes, it may be worth your attention. So, share the screen, hit slideshow, see if it comes up, and from the beginning. Okay, so this is the basis of all illness. Today you're going to learn the actual cause of all illness, acute and chronic, what's the difference, the role of inflammation, and how to pick a practitioner. I know I'm going to get into this, but I'm actually going to tell you how to pick out a practitioner. Okay, you ever wonder or ever notice that many chronic conditions out there have the same or similar symptoms? Okay, which kind of is true. And I see a lot of chronic people, and this is something I noticed, that people come to me with fatigue, chronic pain, mood changes, and it doesn't matter what they've been diagnosed with, they tend to have the same symptoms. And do you ever wonder if there is a common ground to chronic illness? Well, there is. And it is called the cell danger response. Robert Navio, who's an MD, PhD, and works at the Mitochondrial and Metabolic Disease Center at Department of Medicine, Pediatrics and Pathology, University of California, San Diego School of Medicine. So you must think I've said that about 1 million times. Wrote a paper in 2013 talking about the metabolic features of the cell danger response. It is a very complex paper, but I've kind of distilled it down to a level of understanding. So what is the cell danger response? Well, it is the metabolic response of your cells to protect themselves, and thereby you, from harm. And it's also the basis of how you reestablish homeostasis, or how you reestablish normal cellular function. At first, it's a mismatch between your available resources and the functional capacity. So what activates the cell danger response? And this makes perfect sense. Things like heavy metals, BPA, benzene, heat, salt, shock, radiation, trauma. Okay, microbial influences like mold, yeast, parasites, bacteria, viruses. And all the psychological, emotional, and spiritual traumas that we're exposed to, like yelling, abuse, isolation, abandonment, PTSD, and so forth. And I want to stop here and let you know that Dr. Navio has proven on an acceptable scientific basis that all these emotional, spiritual, and psychological things, traumas, can affect your cells, your health, just as much as if you caught Lyme disease, just as much as if you got exposed to mercury or lead. So don't let anybody tell you that it's just in your head. If you've experienced significant psychological, emotional, or spiritual trauma, it will damage your cells just as bad as the other things we spoke of. So when the CDR, or cell danger response, and I'll use those terms interchangeably, occurs, the changes that happen in the body happen in the mitochondria, which is the powerhouse of the cells, and it's a cascade of changes. Now, this next slide is a little bit on the complex side. So what I want you to understand here is that when the cell is assaulted, the mitochondria will decrease oxygen consumption and make the cell more oxidative, inhibiting the infecting pathogen. It will stiffen the cell membrane so the pathogen can't get out. It will release antiviral and antimicrobial chemicals like hypochlorous acid, HOCl, which is available commercially, and do several other things to make the environment inside the cell inhospitable for the pathogen. And on the left-hand side, I kind of made it a little simpler by saying it decreases oxygen consumption, decreases vitamin availability, makes you hold on to the metals that you're breathing in and so forth, instead of just getting rid of them like normal. Cellular fluidity we already talked about. In other words, all the functions of the cells are temporarily impeded in favor of getting rid of or killing whatever the pathogen is. But when the danger is past, notice the cat, when the danger is past, we have a sequence of anti-inflammatory and regenerative pathways that are activated to reverse the cell danger response and promote healing. I want you to think of it as a reboot, the same way you would reboot your computer. This is how our body deals with short-term acute conditions. But what happens when things get chronic? There's a difference. Multiple cell danger responses or chronic cell danger response will not allow these anti-inflammatories and regenerative pathways to reboot the cell function. So you develop a lot of downstream effects. These are your symptoms. These homeostatic mechanisms, which are the regenerative pathways, are ineffective. In fact, the negative effect on the healing mechanisms synergize. And healing becomes impossible unless you treat the root causes and the downstream effects. And there's where the big issue is. This all leads to the root of all evil. And I know somebody's going to jump up and say, the root of all evil is money. Well, to be frank, the love of money is the root of all evil. But the root of all evil here is inflammation. Even Time put out a big ditty on inflammation a while ago. We tend to look at it as chronic inflammatory response syndrome, which is a body-wide inflammatory condition, usually associated with biotoxin illness, that particular phrase, but can be caused by many different things. And what does this body-wide inflammation do to you? Well, practically everything. Okay, this poster came from livelovefruit.com. And if you'll notice, inflammation is the root of practically all known chronic health conditions. In the brain, it can cause autism, poor memory, Alzheimer's, MS. On the skin, it can cause eczema, acne, wrinkles, fine lines. Cardiovascular, it can cause heart disease, high blood sugar, diabetes, anemia, kidney problems. And I'm just jumping all over the place here. Liver, it can cause fatty liver. It can cause fatty liver, non-alcoholic fatty liver disease. And the thyroid, it can give you thyroid hormone dysfunction, thyroid receptor problems. It can also cause Hashimoto's thyroiditis in the lungs. It can cause problems in the airways, allergies, asthma. In the GI tract, it can cause leaky gut syndrome, celiac disease, Crohn's disease, and in the muscles, it can cause carpal tunnel, polymyalgia, fibromyalgia, just to name a few. But the basis of all of it is chronic inflammation, which comes from the chronic cell danger response that does not want to let go. Dr. Navio pointed out in his 2013 study that all of these disorders, all of them, are caused by chronic cell danger response. Autoimmune disorders, degenerative disorders, autism, neuropsychiatric disorders. So what I want you to pick up here is that if these disorders have root causes, which is not commonly accepted, people think that autoimmune problems are a roll of the cosmic dice, and it's simply not true. People think that autism, again, is a roll of the cosmic dice. It is not. There are things that cause it, and if there are things that cause it, we can reverse it. But my doctor said, if we get rid of the root cause, my body will heal itself. Well, in the chronic condition, that's not true. The body treats acute and chronic illnesses differently, okay? And that wasn't well known for a while. Us in the alternative medicine area knew that, but we didn't have the scientific basis for it. In 2018, Dr. Navio wrote another paper, The Metabolic Features and Regulation of the Healing Cycle, a new model for chronic disease pathogenesis and treatment. Big words. Okay. And he acknowledges here that much of Western medicine is based on the principles of acute interventions for poisoning, physical injury, or infection. And when you're caring for acute problems, careful identification of the trigger or the cause of the problem, the anatomical location is important and a part of good medical care. But when dealing with chronic illness, treatments based on the rules of acute care medicine have proven to be less helpful and even cause harm by producing unwanted side effects. And this is not me saying this. This has been proven on an acceptable scientific basis, which I found quite fascinating that a man with an MD next to his name actually wrote. This was in the beginning of this particular paper. So a lot of the people that I treat are chronically ill, but their biggest complaint is they don't look sick. And I found these on the internet, especially this T-shirt that I think is just absolutely precious. You know, with the cat saying, "I don't look sick. You don't look stupid." Okay, and anybody who's got a long-term chronic illness often has been gone from one doctor to another, had one treatment to another. They hit walls because they think in an acute care model rather than a chronic care model. And frankly, they don't heal because the doctors get confused. And since they don't look ill, even though they're quite ill, it's relegated to the psychiatric realm. You also have to realize that chronic conditions take much longer to heal. They've been around for a while. If you have an acute condition, your treatment is generally geared towards resolving the symptoms with a pill. And we're led to believe that this pill for the ill methodology can fix chronic conditions as well. Well, the fact is that chronic conditions are multifactorial. They usually involve many body systems. And by their nature, they're more complex to resolve. A different method of diagnosis and treatment is required to resolve a chronic condition. You have to address the viral, bacterial, or fungal load. You have to discover it and then address it. The accumulated toxicity, because when it's been around for a long time, remember that the cell danger response will not allow metals to be gotten rid of the cell, so it's going to build up. Many other things are going to build up also. And your beliefs relative to your current behaviors, that whole psychological, spiritual, and emotional area has to be addressed. Much less you have to manage stress, manage sleep, diet, the surrounding environment. Hence, the resolution of a chronic condition can take much longer to heal. Okay, that's why the pill for the ill methodology doesn't work. People think that if they do this, if they treat MTHFR, if they do one thing, it's going to get rid of this multifactorial complex condition. And it's simply not. You have to be willing to go after, to discover all of the root causes, identify all the downstream effects, and then come up with a plan that effectively deals with this, that's quite individualized to that particular person. And trust me when I tell you, that takes a lot of training, a lot of experience, but it works. So what do you do now? I mean, you've got this chronic condition, you haven't been getting better, and you're sitting there like the little gentleman over here going, "Oh my God, what do I do?" Okay. Well, this is what you do. I wish I could say you could do it by yourself. Okay. And even if you're a physician like myself, there's an old saying that a doctor who treats himself has got a fool for a patient. Okay. And I've been a fool many times. But the fact is that this is not something you can do on your own. You need a guide. You need somebody to work with you along the way. So I'm going to tell you how to pick out a practitioner. I'm going to give you some tips, what to look for. Okay. First, you might want to think about, is this individual have certifications beyond their original degree? In other words, have they kept up on whatever knowledge base there is out there? You should pick somebody with an eclectic knowledge base so you're afforded true holistic care. What does that mean? Well, holistic care is not a matter of swinging dead chickens over somebody's heads or using crystals. It should be a blending of traditional and non-traditional medicine, wherever it is you need, and your practitioner should have enough knowledge of all the areas so they can guide you. Because when you have a specialist, somebody who just treats one thing, like Lyme disease or fibromyalgia, whatever it happens to be, it's sort of like they have a hammer and everything looks like a nail. So they have to fit you into their protocols. What you need is somebody with a wide range of knowledge who can put the puzzle pieces together, connect the dots, if you will, and then come up with a proper treatment plan. This practitioner will use tests appropriately and know how to interpret them, not just read them. Okay, but most of all, they'll take the time to listen and explain things to you. There are some people out there who will, before you see them, okay, will order a whole mess of tests. It may be appropriate. Usually, if they've spoken to you first, then it's appropriate. But there are some people who you go to their website and say, I'm not even going to talk to you unless you have this $3,000 worth of tests. That's the kind of person who has a hammer and everything looks like a nail. So think about it. You should interview the practitioner before committing yourself to their care. This way, you need to assure yourself that the practitioner is as committed to your healing as you are and will take the time and effort to return you to life. Let me tell you something. I always tell people it takes 6 months, a year. Sometimes that is adequate. Sometimes that's just, hitting the tip of the iceberg. Everybody's different. Everybody's very unique. But what you need is someone who will do the work with you, who will not fob you off on, well, this psychiatric problem. No, will actually look into everything. Okay. And that is a tough kind of practitioner to find. So in this little short ditty today, what did we learn? Okay, we learned that the cell danger response is the root cause of all illnesses. Chronic cell danger response creates chronic inflammation that engenders all the ills we suffer. To heal, we must resolve all the root causes and all the downstream effects. And you can't do this alone, and it's going to take some time. Of course, I'm doing this so you know that I'm this kind of practitioner. Okay, I've been a healthcare provider for 45 years. I have lots of different degrees and lots of experience. Okay, and if you wanted to interview me, you can make a free 30-minute get acquainted session by going to my website, which is drjessarmine.com. But I didn't want to leave you hanging, so I'm going to give you some other names of people that I know that I am very sure work the way I do, have the same kind of training. Now, there are many out there. These are people that I'm just very, I either train them myself or I know of them. I know I've worked with them before. I can guarantee you these people do well. If you're in the United States, Sean Bean, who I call the Great and Powerful, okay, which is at matrixhealthwell@gmail.com, where you can look them up on the internet. Kimberly Verbecki, who's a nurse practitioner. There are more people. Please don't be insulted if I haven't mentioned you. Okay, in the UK or the EU, okay, Paul Burgess at paulburgess.com, Ann Pemberton at annpemberton.co.uk, Gillian Crowther at gilliancrowther@aonm.org, Nigel Forthrup up in Scotland, okay, at nigelforthrup.com, Brianna Dolan at briannadolan.com. And when you go to their websites, you'll find that they will allow you also to get a 30-minute discovery session. And this way you can interview them, be comfortable, and discover whether they're right for you. And south of the equator, in Australia and New Zealand, we have Elizabeth Lambert, who is brilliant. And she can be reached at elizabethlambert.com. So what I wanted to do today was give you an introduction to what the basis of all illness is. Because when you're chronically ill, let me tell you something, you can go absolutely bonkers trying to figure out what's going on. Okay? If you gear your thinking to chronic inflammation and what it can cause, you'll have a good idea of what's happening. It's not just the genes, it's not just this, it's not just that. Okay, it's a combination of things when it becomes chronic. And if you think that a single course or a single pill is going to fix it, you're going to chase your tail for a long time. You need to find a good practitioner who has the qualities we mentioned. And I gave you a few to think about. Okay, there are many, okay, but I did give you a few to think about because I didn't want you to feel that, well, this is just directed towards Dr. Jess. Okay, I've trained a lot of different practitioners, a lot of places in the world. I know a lot of people. Be happy to make referrals. Happy to give you an idea of who is good. And that's why I just wrote this. If you need more, email me. Okay. Better yet, if you feel that you have a condition that is unresolved despite everything you've done, give me a call and let's discuss it. Okay. This was wonderful. Thank you for listening. I will see you guys again soon. Take care.